To Charlie's point, and I think probably it'll show up here, this morning is all about this. Maximizing your presence and influence. Getting you information, getting you educated about the topics, about the issues, and I love the term convergence, coming together and really having influence on these topics. So nice job, Charlie. Really great. All right, if I could, I'm going to ask our panelists to come to the stage, and if you will, just have a seat. Are you all mic'd up? You're not. We've got a mic for you. And what we're going to do is I'm going to ask each of you to introduce yourselves and just give a quick 2 seconds on who you are and what you do in your organization. And then I'm going to kick it off with a few questions, but quickly I'm going to turn to the audience and see what questions you might have for our panelists. So if we can, Carl, do you want to start with just a short introduction of who you are and your organization, and then we'll work our way right down.
It is. My name is Carl Nichols. I'm the Director of Community Wellness Partners here in South Bend. We serve 12 counties in the state of Indiana, covering infant mortality, chronic disease, mental health, and tobacco, and specifically doing work within the minority community. Thank you.
Thank you. We work well together. Hi, I'm Beth Robel, and I'm CEO of HealthLink. We're a federally qualified health center. I used to say Northwest Indiana, but for the last 5 years, we've been in Mishawaka through a partnership with St. Joe Regional Medical Center. So, and we now have a partnership with IU South Bend where we are on their campus. And last year we served about 9,000 patients in St. Joe County and about 30,000 medical and dental and behavioral health visits. And we're here to be the safety net of the hospitals and any community we serve. So we're excited to be here today.
I know this one. Good morning, Latoria Green, Tobacco Education Coordinator with St. Joseph Health System, also co-coordinator of Smoke Free St. Joe. Get in the right position. What we do is a lot of work in regards to tobacco control, so a lot of the topics that we'll be talking about today we'll definitely be talking about, and thank you so much for covering those statistics already, because it's already early in the morning, so thank you for that. But we do a lot of work with the smoke-free air laws. We do a lot of work with our schools, making sure that they have tobacco and smoke-free policies as well, too. So we do a lot of great work, and thank you for having us this morning.
Hi, my name is, can you hear me? Okay, great. My name is Nicole Fallowfield. I am the Director of Health Risk Management at Gibson. I have spent over 20 years working in the wellness industry in some capacity, and now I work mostly with employers, consulting with them on their overall organizational and employee well-being strategies. I also do that internally for our employee owners at Gibson.
I'm going to start with, I've got a question for, well, actually just the projector if you can. Lights are good, because I want them to see who's answering the question. Lights, if the projector, just so they're not staring into a bright light. This isn't an interrogation. Yeah, no, this is, I'm going to pitch you some softballs here. And then, it's just, the lights are fine, it's just the projector. All right, we're going to get started. We can squint in the meantime. All right, I'm going to start with you, Nicole, if that's okay.
Sure.
All right. So we've talked a lot about the places where we can have influence and can make change. And we talked about that many people in here are hiring employees and their employers, and we all work in organizations. And so what is the calculus or the math or the thinking that employers are doing when they look at health issues in the workplace and among the workforce? And what trade-offs are they weighing when they're making those decisions, because you work with many employers?
Yeah, so I would say that primarily what they're looking at is in the context of healthcare spend, because I can't think of any employer I work with that doesn't offer health insurance to their employees, and so they see their healthcare spend as being number 2 or number 3 next to payroll. So one of the top 3 items in their budgets is health insurance, and so one of the things they're looking at is, well, first of all, where are we spending money that maybe we could redirect? Can we redirect in a different way to have a better impact without compromising offering a great benefits package to employees? So I think that's one of the first things that employers are looking at. I will tell you that most of the employers I work with are a little bit frustrated because they feel like the healthcare spend is out of their control. And when you look at some of the data, there's a lot of truth to that. So a lot of the healthcare spend is on things that are largely not going to be impacted by things like employee wellness programs or differences in copays or things like that. They're spending money on high-cost specialty drugs. They're spending money on some of those unfortunate, tragic things that happen. So in the employer's mind, it's what are the things that we could control? How do we navigate that so that we're not putting ourselves in an adversarial position with our employees? But then also, how can we also, if we're going to tweak our benefits plan, make it so that there's not a lot of abrasion to the members that we're trying to serve? We want it to still be competitive with the health insurance. We want people to have access to care. So it's really a global look when they're looking at their spend and what's the most appropriate way to tackle that.
Thank you, Nicole. I'm going to jump to you, Beth. Nicole just mentioned access to care, which if you're employed in this community, in most communities, many employers provide health care, but there's a large population of people that either are uninsured or underinsured. They might have a little bit of a benefit, but not enough, and certainly sometimes not enough in the health and wellness area. And so as you run what's known as a federally qualified health plan and clinic, and so you really are connected to what's going on in Washington and around the state and have developed a system of care. And so maybe if you talk a little bit about why that matters and how that works to address the population that employers don't.
Right, and I want to make a comment too, a little bit about employers
Sure.
when we're done. So I like to say that FQHCs put the neck back in the body. The last time I checked, we were all connected. But a lot of times the health system is disconnected. You know, you go over here for dental, you go here for medical, here for behavioral health. We really work to treat the whole body. So our providers, we get a mix of providers that are in there. You know, the dentist will refer to the medical. Great story. We had a dental patient, and she had said something about her arms were bruised. The dentist noticed that and looked in her mouth, and there was bruising in the mouth, and said, I don't think this is really right. You know, can I go get one of the medical providers? And they went over there, and she had early stages of a leukemia. And so being able to attach everyone, behavioral health is a huge issue. I just spent, I think it was last week in DC, really talking about meeting with people about the opioid issue, which affects everyone at every income level. I also, and it goes to your comment, we've started, not that it was really our core, but the word underserved and underinsured. You know, if you're making $40,000 or $50,000 and you've got a $5,000 deductible, you know, a lot of our employers are paying for insurance that their employees don't even use. So we're working with one broker now to actually go in when it's time to for them to sign up and looking and saying, you know what, this person potentially could get on the Healthy Indiana plan. If you haven't heard, I'm a real proponent of that. And really get them so they're getting served. For some of those that fall in the cracks, you know, one of the things we've looked at is that employer was willing to pay for a couple sick visits and a wellness. So the patient came in, we do a lot of screening for mental health. We do something that screens for depression. Every one of our patients once a year gets what they call PHQ-9. And at the bottom it says, have you thought about taking your life or committing suicide? This patient came in, this was one of the employees that this employer was paying for, and they said yes. So we got them into inpatient, we got them stabilized. Of course, we couldn't call the employer, but the employer called us. It was one of their best employees. And if it hadn't have been, they claimed for that visit, that person might have followed through with their suicide plan. So it's really treating the whole body, and the federal government has funds and has worked to make us be able to do those things.
Thank you, Beth. You talked about access to care, and as Charlie pointed out, Carl, there are many disparities in not only access, but outcomes of care, especially in the minority communities. And so your area of work is right in that lane. And so what does it look like when minority health issues and concerns are integrated into the community and the public health approach and the public health interests? So what does that look like, and what are the opportunities?
So just a little backstory for those who don't know me. I have had the wonderful opportunity to be a father to two wonderful sons, both African American. And my oldest, at 11, was diagnosed with leukemia. And so being in public health, you're like, man, you read all the statistics and you look at it, and you look at the specific type he had a 20% chance of living. And so having an educated family, we have insurance. He and I got into an argument about a video game he wanted to buy. I said, we don't have the money. He said, well, don't we have insurance? I said, yeah. He's like, well, we can afford it. So he didn't understand out-of-pocket expenses at 11 years old. But when I told him, he said, well, what do people do without insurance? And I said, man, I thought about it. Because when I first started working, I've been here 10 years, it was about making the business better. It wasn't a passion. Then it turned into a passion when I found out I just told them they die. They die because they don't get the quality of care that they need to live. And he's 18 now, getting ready to go to college in the fall. But at that moment, being faced with that despair of that diagnosis, we look at the families that we serve that already appear to be in a hopeless situation, whether it be in poverty, whether it be in employment. So we look at those social determinants of health to see all of those things, and we look specifically in the city of South Bend, where we look at the infant mortality map, but if you happen to lay over the infant mortality map on top of the food desert map, on top of the lead map in South Bend, then you can see all of the issues are in very concentrated areas in our city. And so what does it look like to be able to serve the minority community effectively is that we have to have more community investment in those places that have not seen significant community investment in the city, from the city side, from community-based organizations, from city plans to hospital plans. They all need to include those elements of the community that seem to get overlooked sometimes. Many times it's not in the plan. You mentioned the unemployment rate, but if you look at the African American unemployment rate in South Bend, it's almost 25%. That's an issue, because you aren't going to get any family member to go to a health class, a workout class, a cooking class, a well child visit, a doctor's appointment, anything, if they're working 3 jobs trying to survive in their daily life of survival. If you look at kids not going outside, it's more significant in communities of color. There's violence, the sidewalks are bad, poor lighting. The parks aren't, the city just did, I met with the mayor, they did a study to see how many children don't live near a park, the very same study. It is much further away in communities of color where children live next to a park or a bike lane. So these are the things so when we're looking at the build of the city, that impacts the health. And so our organization is not just working with people, where we do try to empower every individual, but it's also working on that public policy and the way it is. The impact of working with the safety pin legislation in Indianapolis to make sure that these communities did not get missed and that they specifically address Black infant mortality and not just the overall infant mortality. Because if you decrease those disparities, the overall number decreases. So if we're looking at how do we have an approach that's integrated, we must include a plan for minority health, access, and equal health in all plans we do, whether it's in the healthcare, it's in city planning, it's in economic development. We have to make sure we include those.
Great response, and really does matter. And just 2 more seconds on, you really, I think, made the point about in the minority community, those issues, but why should the rest of the community care? We look at employment. People are hiring. Everyone needs a job. Most people want to work. It's about having the ability. We look at education levels. We look at the dropout levels in South Bend. We look at the quality of education in South Bend. And you look at the school to prison pipeline. And so this all matters because the health of the community overall is impacted by these areas that are suffering. And so
we look at how no one wakes up in the morning and says, I'm gonna go commit a crime. But you do wake up and say, how am I gonna take care of my family today? What is my options today? So it impacts the community. The gun violence in South Bend impacts the entire community. So we talk about health, it's not simply chronic disease, infant mortality, but we look at these other issues that impact the health of our communities overall. So it impacts everyone, and it takes everyone to help make a difference. Because we talk about that one, and closed my eyes, I thought about my oldest son. I was like, what if we would not have positioned ourselves to have the insurance to take care of him? Would we still be going to a graduation May 30th? You know, so these are the things that when we talk to people in our office, that it's not just dealing with this situation. You know, we look at our infant mortality program, the Speak Life program. We've had 150 mothers go through the program. We have not had one infant death in a year and a half of the women in our program. But we just don't deal with that mom. Is there someone in the house who needs a resume done? Is there someone in the house that smokes? Is there someone in the house that wants to go back to school? How do we make all of that happen so we can create a healthier environment in that house, and then on that block, and then on that street?
So the whole community caring and partnerships really matter.
Right. We have to get out, as public health, we have to get out of these silos where we're going to do it here, and we're going to do it better than you, and we're not going to share information because we're scared you're going to steal it. Like, we have to just let go of that and bring it all together.
So, Latoya, I'm going to come to you now. And really, you've worked in the area of building partnerships and really been responsible for the tobacco and the tobacco grant and some things in this community around trying to affect and impact smoking in our community. And we've seen how that issue can affect a lot of other health issues. So if you can, maybe you can talk about the partnership that's you've helped create in this region to address it, including the model of the smoke-free air law, and how the laws embraced post-passage has been embraced, and how you're continuing to work so that it continues to be successful longer term, and we continue to see that impact those rates of smoking over time.
Definitely. So with Smoke Free St. Joe, we're a community coalition. We're comprised of healthcare organizations, community-based organizations, basically even individuals who have a concern with regards to smoking as well too. A lot of our work is regards to making sure that no one in our community should have to trade in their health for a paycheck. And so meaning that I could be able to go to wherever it is that I want to work in. It doesn't matter if I want to work in a restaurant, if I want to work in a bar, that my health isn't something that I should be thinking about. Of course, we want to make sure that we are expanding that, so we're very fortunate enough for the work that we're able to do here in South Bend, where we were able to get together a number of different organizations that had, number one, a common goal, and I think that's pretty much what helps is to have that common goal, that common focus, but definitely making sure that we had that ground root support in regards to that as well too. But definitely we're very proud of the work that we've been able to do in regards to that. Of course, our biggest accomplishment is the South Bend Smoke-Free Air Ordinance, which is the strongest ordinance in the state of Indiana. And I didn't hear that many claps when that was mentioned before. Thank you. Which is, you know, phenomenal work, and it speaks to the collaboration that we had. I know you had an issue with that word collaboration earlier, but it does speak to that collaboration, that partnership that we were able to do. Now, one of the things I do not want to try to paint the picture is that, oh, it was an easy process by any means, or that, you know, oh, we just went in one day and yes, they made the law for us. I think that was a process that was about 6 years in the making for that to happen, but we had to make sure that we kept it on the minds of our lawmakers, and making sure that they understood that even though we may have had a loss in the past, but that doesn't mean that the issue now goes away. So we were very fortunate to be able to do that. Of course, our goal is to make sure that anywhere in our community that no one should have to, you know, have health as being one of their concerns if they're working in an establishment. So not only do we want to have it in South Bend, but increasing it throughout the county as well too. And so definitely we hope to have that support again, which I know we will, right? Have that support again with having that and expanding it out into the community. The reception of the law has been phenomenal. I think like within our last a year plus now that we've been in our implementation, that we've had less than 5 as far as like complaints in regards to that, which is something that we tried to stress that, you know, for the most part, we're all law-abiding, citizens. Like you said, no one wakes up saying, you know what, I'm just going to allow people to smoke in my establishment. Who cares what they're saying? So people are going to abide by the law. Unfortunately, sometimes we have to take it there, for them to really think about that. But it's been very, very fortunate that we've had. It's really shown the growth in our community as well, too, because that was a major concern that some people had, that it was going to drive down business. My establishment is going to close down. Well, we're actually thriving here in South Bend, where we actually have, and just speaking in regards to bars, that we have like 3 bars that have now expanded or opened up here in downtown. And I think we have another one coming pretty soon as well, too. So it just really speaks to the growth that we're able to see in this community. But definitely it does take a lot of partnership. That's one of our things. Myself and Carl, we both work on initiatives with Smoke Free St. Joe, and we always love it when we're not the only ones in the community talking about it, but that we do have that community that's surrounding us and supporting us.
Great, thank you, Latoya. All right, this is your opportunity to throw in a question. Does anyone have a question they'd like to address the panel? I've got several more, but I didn't want to monopolize. In the back.
So, Carl, I feel like
If you could, stand up and speak loudly.
So I feel like the question still wasn't answered about why other people should care. Because when I look in this room, there's not a lot of heavy minority attendance. So why should other communities, other residents in this region care about the issues that are happening in the minority community? And I still feel like that needs to be addressed.
I guess for me, that is a difficult question to answer because I know my personal experience. But if I think I look at the overall community and how, if we are all living to the mission of where we work, if we are all living to the calling that we have as community members to be a neighborhood and not just a hood, you have to be a part of what you do in your community. I look at, there are several neighborhood associations in the city of South Bend, and they are they are not diverse at all in the neighborhood associations. And so we have other organizations working together to kind of bridge that gap to bring the neighborhood associations together. But I just feel the importance is that if anything is going to change, everyone has to be involved. And we look at, and I guess I look at things differently. If you look at where the power lies in our community, we have to engage everyone because that's where the ability to change policy lies, with everyone caring and concerned with it. I spend so much time at the State House not just looking at specific policies that affect minorities, but how could they possibly impact the minority community? There was a policy up that in the city of Indianapolis that it would allow the police force to have free decision-making if anyone was impeding progress in the streets. So if there was a protest in the street, they could use by any force means necessary to move that protest. Well, that opens up a can of worms, right? There was a bill out that would prohibit the purchase of cold medicine at the stores. Well, we know why, because of people purchasing meth. But what about the person who doesn't have a doctor or insurance who just wants to go and get some cough syrup, right? So it's all of our job to inform how policy can impact communities. And the caring part, this political climate that we're in currently has allowed people to feel free to say whatever comes to their mind. We see it every day on social media. We see it on the news. We see it from the White House, that a tweet at 3 o'clock can spark a controversy in a community that has no direct impact on that. And so we have to engage these conversations, and it's important because if we want a healthy community, because health isn't just physical, we have mental health. And if our mental health is in our communities that we're scared to go outside, we're scared to let our kids go outside, we need to communicate that so that can be fixed. Because the policymakers that may not look like the communities that are impacted need to be educated. Because I believe that our lawmakers aren't just mean people. They're really underinformed. I look at, there's no way that the number of bills that our downstate policymakers see, they're able to read all of them, right? So it takes us to inform them, hey, did you see page 6? I don't think you saw this section. Oh man, I didn't even read it. We had my legislative assistant read that, and they didn't share that. And so all of us have to take a part of that to make our communities a thriving place, not just physical health, but happy. Because you can go outside sometimes and you can just feel the density that this is just not happy right now, and being willing to have those conversations. And there's not a whole lot of difference between people. And if you just take that time to talk to somebody, you're going to see a lot of more commonality than you see differences.
So let me add, if I can. And I think everybody's heard the chain is only as strong as its weakest link, and I've never really liked that. My wife, she'll say, a parent is only as happy as your unhappiest child. How many of you have kids? At any given time, you as a parent can only be as happy as your unhappiest child. And I would say we're only as healthy in our community, and we can only be as safe, as happy, as healthy, as the most unhealthy part, the most unhappy part of our community, the most unsafe part of our community. And so I think that we have to have the mindset that if I individually want to have, as I used the term earlier, happy, healthy, awesome, I think about that as a CEO. I'm only going to be as happy, healthy, and awesome as a CEO as the unhealthiest, unhappiest, and least awesome individual I have in my organization. And so it is incumbent upon me and us to work towards raising the standard, raising the level for everyone, right? I mean, and that's how I break it down and make it simple, right? It's on me. It's on us. So, all right, other questions? Yes?
You know, I wanted to...
If you could, stand up and shout it out.
Thank you. Carl, in this, what I'm thinking of, Lisa Palmer at Tech Community College Health Division, you talk about like minorities and about approaching them. And my thought was how to get the biggest bang for your buck. And I was thinking like the approach could be go to where you have individuals working in certain levels of that employment scale in certain organizations. And I'll just use Press Gaming as an example. Press Gaming has different levels of employees in the organization. And one level is your cost center, where people are making from $10, $11, $12 an hour. But you have a broad group. It's not just black, it's black and white. But still, they're in that same socioeconomic level. So it seems like sometimes people don't know how to start or how to get involved. But it seems like it should be up to those that are in certain positions that can go there, that can give them information. And I talk about going to talk about health or talking about education, how health can become better. But maybe just starting with one. I like how you said, you don't need to be sometimes really broad with just one. So maybe one person gets like, and that one person walk, or that one person like get help a plan to increase health. Or having someone come in and talk about health, or having someone talk about education, health education in the community colleges or even in the four-year institutions, how to get started, how to look for online classes, how to like maybe approach education in a way that maybe they didn't think about. So it seems like it's just giving them information and maybe they just don't know how to get started in those ramps.
So, Carl, do you want to take a shot at that? And then I'm going to ask Nicole to respond too, because she works with a lot of employers. So do you want to start, and then we'll kick it to Nicole?
I think specifically for our organization, health fairs is not the way to do it, right? Because people just come for the stuff that's on the table that's fun, and maybe you got a Jolly Rancher, or they like the stress ball, and they're going to take the bag, and when they get home, they're going to throw all the information out and keep the bag for other stuff. But when we talk about where do we get the most bang for our buck, it is going into churches, going into community centers, going into these employers, like you mentioned, and having that conversation with them. And being I like to think of us as not just a provider of education, information, and programs, but also a dot connector. Because we don't do education for school, but we know who does. And having that information available and readily, and all of our staff having that same knowledge, so when someone calls or comes in, or we engage someone who hey, I want to quit smoking, but also I need to go back to school. Oh, we know how to do that, and we can help you with this. And so being that dot connect, not trying to be an expert on everything, do what we do really well, but also know who else does everything else really well. So I do like that, going and getting the most bang for your buck. And that's one thing that we learned. I think when I first started, we tried to do everything. We wanted to tackle kidney disease and this and this and this. I'm like, man, we can't do that. So we need to pick what we can do and do it really well, but also know who else does it really well.
Nicole, do you want to chime in on this question?
So, yeah, I never get accused of being quiet. So, I think first, at the employer level and in general, I think we need to reframe the word, what health means. And I can't remember who said it, but somebody said it's not just physical health. But I think in most people's minds, that's where you go to, right? You think, oh, if I'm healthy, it means that I look healthy. And so I think we first have to reframe it. I think the second thing we have to recognize no matter what type of industry you work in, community, business, no matter what, we have a health literacy problem in our country. And so I think some of what you're touching on touches on that health literacy aspect. So it's not just about information, but it's information that's meaningful and actionable. So if I don't understand what you're telling me, then I can't act upon it. And I will give you a perfect example. So I spent many, many years health coaching. And so I worked with what would be qualified as at-risk patients. So people who were either had diabetes, who might have high blood pressure, high cholesterol, or they had what we call multiple risk factors that, maybe metabolic syndrome, things like that. And so, perfect example of this, I'm talking to a gentleman on the phone, and he said, and he had had diabetes for many years, and he said, oh, this is a perfect timing for our phone conversation because I just met with my dietitian, and she told me I needed to eat more protein. What's that? And on the other end of the phone, I know my jaw had dropped, and I'm thinking, oh, you've got to be kidding me. So we just assume, unfortunately, that people know what certain things mean. And so I said to him, okay, let me tell you about what are some different sources of protein. Now you tell me what you like to eat, and let's figure out what makes sense for you to include in your diet. It's a perfect example. This was an educated person. He did not understand what she meant by saying include more protein in your diet. And then when it comes to employers, and I'm unfortunately not very popular some days with the clients that I serve, because I'm trying to help them to think differently about health and well-being in their organizations. Because unfortunately, we've been very myopic. We've said, and I think Dr. Fox hit on this perfectly, yeah, we've got this biomedical piece down, great. But nobody talks about social determinants of health. Nobody talks about the fact that how you feel about your finances, how you feel about your job. If you hate your job and you have a horrible boss, guess what? Your health is going to suffer. So you have to look more holistically. So I think it starts by reframing what does health mean. You have to reframe it in a bigger context.
Please.
So this whole social determinants, or we like to call them social drivers, because we don't think it's the end. It's a driver right now, but we're gonna go in there and intercede. Employment is huge. I just, last month I was in DC fighting our National Association's attorney because she wants to file a suit in Indiana and for the Healthy Indiana Plan Gateway to work. I personally, my staff has looked at it, and when we look at it, 62% of our patients already work, so they're out of it. If you're disabled, you're not on it. If you're a mom with kids in school, they want you to go volunteer at school. My gosh, yeah, I deal with a lot of school systems, and they all say, I wish we could have parents involved. But that small percentage, if they may not have a GED, so now they have a way, the managed care entities are gonna have to help them get that. And then if they wanna get a job in the education, they can get connected to Ivy Tech. And if they can do that, and they can get a meaningful job, their health is gonna improve anyway because of that whole mental health, your finances and stuff. So I agree with you that that's where, and we do a lot at our sites with Ivy Tech, because that seems to be a really good partner. Again, I know we're not supposed to collaborate anymore, but we collaborate with that what we do, we started doing surveys, so we have all their social drivers now, and so we have to work with them on that, so I appreciate you mentioning that.
Well, you know, and I wasn't trying to like just plug any type, like just for that, but it was just, you know, you see these different, individuals who are in the same neighborhood. I mean, it is mostly minorities because that is the group that seems to be overlooked, but in the lower income. But it's not just that. You have white in the lower income, that's in that same role, it's
But
in
if
that
you look at the
same.
physical health, minorities are disproportionately affected. So they both can have the same income, be the same age, have the same level of education, but that cancer is gonna affect them more, that heart disease will affect them harder, that tobacco addiction will affect them harder than it will their white counterparts. So you can have a lot of the same indicators, but where we come into play is that we know that you looked at the black infant mortality rate was 2 times, 3 times higher than the white infant mortality rate. These women can have the same education, the same health status, the same monetary income, but that black woman's gonna be affected much more than the white woman. And so that's where we put our work in, because we know that they live in the same community and have the same finances and same other situations, but we know that health is gonna get impacted more. And we know that white people start smoking earlier in life, but African Americans are impacted more by the tobacco. If you look at the stores in the neighborhoods, the way they're marketing tobacco products towards the youth and to minorities in those neighborhoods, they have these things called tobacco swamps. We hear deserts, now there's tobacco swamps. But if you look at the zip codes with the higher minority population, there's more tobacco stores in those communities than there are in other communities. And even how they display and advertise tobacco. So there's an intentional approach to marketing towards community members, right? And then they know that the physical addiction is going to affect them more, and the health is going to affect them more. So that's where so not saying that the other people aren't affected, we just know where there's more effect.
And I think it's important to go back to your earlier point about it doesn't matter, it does matter. What, at a public policy level, policy is going to be set, but having subsets or plans within that address each of the specific populations and their specific needs or effects on them is very important, very important. Other questions? Yes?
Good morning, my name is Laura Baker. I'm the VP of Urban Cancer Services, and we had heard a little bit earlier in the presentation about how Indiana as a state isn't using funding, or we rank very low as far as funding towards, I guess, healthcare in general. How would that increase in funding be used to sort of catch up with our peer, our other states, our peers, that would trickle down specifically to these sort of programmatic? Where are we missing the boat? Where is that funding being directly connected to sort of these issues that we're speaking about this morning?
Well, let me make a comment, and then Latoya, you might want to comment on kind of some of the funds flows, if you will. One of the things we're going to ask of you today is around the tobacco tax. We mentioned that earlier. Every state has a budget, and every state goes through every year the dilemma of, do we have enough dollars, and where do those dollars flow? And so one of the mechanisms by which we hope to increase public health funding in the state is to do so through the tobacco tax. So it's tying the requirement for those dollars to flow into public health programs. And so part of your question, I think was, help me if I'm off base here, was kind of how's that going to work? How are we going to get more funding? And then if we get more funding, how's it going to make sure it flows to these programs and they get used, right? And is that part of where you were headed?
I think it's more the idea of what is it that other states that are being funded fully, where are we missing that boat? Where is it? What are we having to give up? Not necessarily where the funding is coming from.
Well, there's always trade-offs, and I will tell you in Indiana, and I heard you talk about road. Did you say roads? Well, in every state has different priorities and different issues, and it comes down to public lobbying and messaging to your legislators and where the pressure comes from and where they think the priorities are. And there are trade-offs: education, healthcare, public utility, roads and safety sort of issues. business growth. I mean, there's a vast array. Most of you have probably been down at the State House. I don't know how many of you have. Earlier in my career, I was shocked when I walked in to really get educated about all the different lanes. Like Carl said, there is so much these people have to know and read. Public health is one small, tiny lane, and it's competing with everything else. And so the question is how do we make it more important, more of a priority? And so there are gives and takes all the time. So do you want?
Really, to your point, with that, I mean, we would love for every dollar that comes into the state goes towards public health, as it should, right? Especially if it's earmarked for that. For example, the master settlement. There's like 46 states that have sued the tobacco industry. And so for Indiana's portion, we get about $120 million each year in regards to what our portion is with the master settlement. And in the last few years, we've only had about $5 million going towards tobacco control, while as the tobacco industry is spending $288 million on their marketing of their products in our community. So we're already at a disadvantage. Now, last year we did get an increase about $2.5 million, so now we're at $7.5 million, but far below where we should be in regards to that. Now that money comes into the state, but it is our legislators who decide where that money actually goes towards. So having that, like you said, that advocacy and making sure that we make that demand with our legislators and saying, this is where we need that money to go. And definitely your point you said, we need to have more people than just those who are within that field asking and demanding for that to actually happen. So like you said, whenever we're having those advocacy days, they need to be filled with people within the community to be able to make those requests for that. Because we feel that every dollar that does come in, especially with the cigarette tax, it definitely should be included in that. And I think there's a lot of federal dollars. I've looked at like California, New York. For some reason, when there's money for federally qualified health centers, they get it. Maybe we're not trying hard enough. In the last week, after I was meeting with one of the FCC commissioners. There is a whole, which I don't think most people know, pot of money that the FCC has for healthcare. We did not. I know about that. I don't think most people did. And you're gonna look it up, and there's a lot of it. And then the latest one is the Federal Reserve in San Francisco is doing healthy communities. They're funding around San Francisco, well, actually in the Oakland area. Again, some of the high minority, and they feel like if they fund that, it's going to bring up the whole community. So, but what I've seen in both those cases, it takes a lot of, I know that's what I always use, collaboration and partnerships. That's what I think it has to take. And I think this is the first step to, well, and we've done a couple steps now, but to get those collaborations together. And I think the federal government, that's our tax dollars going out and not coming back. It's one in California, New York.
And I think if you look locally, like we have a county health department whose office is severely underfunded, but outperforms their budget. They do a lot of great work, but they are severely underfunded. So the city of South Bend is trying to invest in health, but they don't have the budget because that's not where our county health comes from. And so I think it's important statewide that we have to find champions in our legislation, in our legislators that will continue, no matter what the conversation is, that they bring up health. You know, the max $7 in Ohio were so misused for roads and other things that now the tobacco company is suing Ohio to say, look, we paid this max $7 out for these purposes and you guys are doing this with it. So now states are being sued by the tobacco company because they haven't spent the money and allocated out the way it was intended. So I think it's really important upon us, both locally, state, to find champions for health and find that story that tugs at their heart, like Chad mentioned, how they can support that. We have Representative Charlie Brown over the last 10 years. He can be in the room talking about spay and neuter cat policy and say, well, what are we going to do about tobacco? What are we going to do about tobacco? We constantly bring up, we constantly that champion. They know when he walks in the room, he's going to bring up tobacco. So we need to find more champions like that about all of the health issues so that no matter what they do, whatever, so we're supporting this, but now you can support healthcare in Indiana and bring that level up. We're so far underneath the CDC recommendation for what we spend per capita in Indiana, it is ridiculous. And the cost of, and we center around tobacco, the cost that tobacco costs healthcare industry, the workforce for unhealthy workers, nowhere meets what they're funding to do programming in the state. So I think the biggest part is to find those champions within our state legislature. And if they're not, get rid of them. Go to the polls and get rid of them and replace them with people who are champions of health. And how do you find it out? You interview them, you talk to them, because in essence, you are going to hire them to be your representation, so you would interview them if you plan on hiring them. So find out where they stand and hold them to that. You know, we get these circulars in the mail about what I plan to do when I get elected. We never keep those. We throw them in the trash. They take up room in our house. We never think a year later to say, where are they at on this flyer? What have they done since then? So we have to be more intentional about talking and interviewing to our legislators and finding those champions for our causes.
And I know that like sometimes people have an idea with, well, that's in Indianapolis, and I know sometimes it's hard for us to give up our work days or work hours to actually make those trips. But they do have third house meetings right here in our community. And I believe there's more people in this room that actually shows up at those third house meetings where you have those opportunities to be able to talk one-on-one with those legislators. And so get on the chamber's mailing list if you're not already, to find out those dates for that.
Other questions?
Question, I guess, is we look at our education system and people say, throw more money at it. You look at this, throw more money at it. Judging from the history, it doesn't seem to be getting any better. I know with Beacon, you've been involved in innovation majorly, so from an innovative perspective, from benchmarking, I've seen other communities that are successful and have done so efficiently, financially. What do you see? What does anybody see out there that's happening that we bring into our community in an innovative way, keep costs down, because say, who's paying? It's our money that's going into this. So I'd like to see our money more efficiently used. And just the question is, what innovations do you see?
Loud enough? There, I'm on. I think it was important, Charlie's presentation, because one of the most efficient uses of dollars is often in kids, in terms of the pliable yet developing mind and awareness. And years and years ago, I don't know how many years ago, Memorial at that time started something called HealthWorks. And that was all about health education with kids. And they did a couple studies that showed they could have a dramatic impact on not only the child, but the parents in the home, if you educated the child and they brought that information home and they said to their parents, hey, I learned about brushing my teeth today, or I learned about smoking, or I learned about healthy diet and those sorts of things, that there was actually an influence that flowed through, and that you were more likely to prevent bad behaviors longer term, or poor decision making relative to health. And so I think it was important to have Charlie's information here to say, hey, look, here's what's going on in the kids' population, and it's not that different than what's going on in the adult population: opioids, obesity, smoking. And if you think about the tobacco issue, getting education and creating hurdles for kids relative to that issue will do a lot in terms of prevention down the road. And sometimes it's hard to make those investments that pay off, 10 and 20 years later. It's like I was saying about my grandfather. I wish, had I gotten to him 20 years prior, 30 years prior, would he have lived longer and had a better life longer had he stopped earlier or never started, right? And so I'm a big believer in childhood efforts. And so Charlie's information was important. And we're currently in a conversation with the Ethos Science Center over in Elkhart. How many of you know about Ethos in Elkhart? A lot of you. They're a science center over there focused on the STEM programs, science, technology, and math. And we're working with them to introduce health into that as a component of what they teach and distribute. And they've got a very strong distribution mechanism through the schools on those topics. And so again, it's getting to all the kids where the kids are. So that's kind of where our focus is and thought process is around that. I'm sure there are other states there are other states doing much better than Indiana, and it's a multitude of factors. But again, I would say a lot of that does have to do with priorities at a public policy level and the things they either do or don't support. And I agree with you, it's not always about just total dollars, but it's the efficiency of use of those dollars. So not a ton. Jennifer, and by the way, come up front a minute.
I
So-
just wanted to first speak to our policy on changing the age from 18 to 21.
Yep.
I think that's something that would be, positive and help impact the youth.
Go ahead.
Which is another priority we'll be working on this upcoming legislation. For one, we know we want to prevent the next generation of tobacco users. That's exactly what, at least I can talk about those long-term effects, that if we can get the next generation to not even think about picking up, let alone cigarettes, but any tobacco products, then think about the different health outcomes that will actually be increasing on a positive end in regards to that. So there is legislation. We tried this, I think, that we tried to increase the age of purchase from 18 to 21. And it was in regards to all tobacco products. Because that's one of the things that we try to focus, at least sometimes the focus tends to be on cigarettes when we need to be focused on all tobacco products. And so what we want to do is that we want to increase the age because we know that way we don't have an 18-year-old buying tobacco products and now giving it to the 16-year-old. Well, a 21-year-old is not necessarily going to be hanging out with a 16-year-old, 14-year-old. So we definitely know that we're putting some dents in regards to that. But also, we have to be concerned, like I said, with the other tobacco products as well. Of course, I have another bag. Because as we were doing some surveying of some different locations around here, we found that, a lot of these products are actually in the price point of our youth. The most striking one that I found, or at least I looked found, is kiwi strawberry cigarillos. And look what that price is for that. $5 for $1 as far as the price point in regards to that. You have the 18-year-old being able to go into these stores and purchase these products, or even the e-cigarettes, for example, as well too. Being able to give these, and what stops them from being able to give these out to other, young folks. So again, getting it out of the price point of our youth, making sure that we're increasing, or at least trying to disrupt the access of these tobacco products for our youth. And so that's something we definitely will be working on, is increasing the age of purchase to 21, as opposed to keeping it at the 18.
So if I can, as we wrap up, take just a few minutes to make a closing comment or parting comment for today's group, something you want them to walk out of here with, or knowledge or information or a call to action. So I'll just go right down the road here. Carl?
I think for me, too, just real touch on really quick, being innovative in those dollars and how you spend them. Doctors and nurses have a very important part of our community, but also using dollars to train and educate community health workers. It's an affordable way for organizations to get education out to the community. So that's an innovative approach. And cross-training is different. We're currently going to start working with the local health system to use community health workers to cross-train them as recovery coaches to help opioid addiction moms. So using those that are very important, that they don't be a doctor or nurse. But I guess my final call to action is to feel free to engage your policymakers. That's what they're there for. They're going to decide in a day, because their job, once they're elected, is to get reelected, right? They're going to decide, not based on experts coming to their table and giving them information on either side of the case. They're going to decide based on the number of calls, on the number of letters, on the number of emails, text messages, visits. They're going to count those up, for and against. All right? 80% of people want this. This is where I'm going. And so if you get complacent and don't engage, then your voice won't be heard. And we all have that opportunity since we live in this country to have our voice heard. We need to use that voice to get that change.
Thank you, Beth.
I guess my big thing is that it's not just about whether you go to the doctor or not. It's what you know, and treating the body as one to be able to help our patients improve their health. And if we can improve one by one people's health, we then improve our communities. It's going to drive down the overall cost. And then she can go renewal time and say, hey, 5% this reduction instead of a 5% increase. So that's my
Like I say, 2019 has to be the year that we really are focused on tobacco. We can't gloss it over anymore. We can't put a Band-Aid on it. We have to really tackle it. And one of the ways that we can do that is what is called the tobacco control vaccine, where we need to make sure we have tobacco price increases. We need to make sure that we have smoke-free policies within our community. We have to have a hard-hitting campaign. So right now we have our Tips for Former Smokers that is running on a the airways and the TV stations as well. And we also have to have access to cessation services. St. Joseph Health System provides free tobacco cessation classes at least every quarter. They're totally free, no charge whatsoever, open to anyone in the community to be able to take advantage of that. So those classes definitely should be packed out in regards to that. But just touching a little bit more in regards to the tobacco price increases, if you want to have your voice heard, we do have some postcards. We work a lot with Tobacco Free Indiana. So I believe Kent's out there in the foyer there. There is Kent up there. So if you'd like to have your voice heard, please fill out these postcards for that. But then also on the local level, Smoke Free St. Joe, you can always go to our website. We have our meetings every second Thursday of the month at Community Wellness Partners. Yes, it's 8:30 in the morning. That's what it still comes to work. So come on out, join these initiatives that we're working on.
Thank you, Latoya.
Okay, I would just say, my closing comment, don't let apathy become the reason that we don't improve health in our state. I think everybody talked really eloquently earlier about, impacting that one person. So how can you make an improvement for yourself but then somebody else in your life? So we don't want to add apathy to that list of the biggest health issues in our state.
Thank you. Let's thank our panelists this morning.